You know, patients often ask, why have I not heard about Interstem therapy? Well, one reason involves the maker of Interstem, Medtronic. And remember, Medtronic is also the manufacturer of the heart pacemaker. And just like with the heart pacemaker, you really don't see any direct-to-consumer advertising for Interstem. In other words, Medtronic relies upon physicians, not TV commercials, to educate their patients about this therapy. Now, this is not an uncommon practice for manufacturers of medical devices. And let me give you another example. Tubal ligations. You know, in the past, this required some form of surgery. However, I can now tie tubes during a 10-minute in-office visit. The procedure is called Essure, and it's performed without any incisions, no anesthesia, minimal discomfort, walk in, walk out, virtually no downtime. Amazing. Well, I've been performing it this way for 10 years, yet most people have never heard of the procedure. Well, why is that? Well, because the manufacturer relies upon physicians to educate and to offer this procedure to their patients. Now, here's what's interesting. If you ask gynecologists, what's the best way to tie tubes? Most would agree that the Essure is by far a superior procedure. However, only 30% of all tubal ligations are performed in this fashion. Why? Well, the simple reason is not all physicians offer the procedure. And those that don't are hesitant for whatever reason to refer their patients to a colleague that does. Unfortunately, the same applies for Interstem. Now, I also get the question, well, why hasn't my doctor mentioned Interstem to me? Now, I say this with respect, but either they don't feel as if you're a current or a future candidate for Interstem, maybe they haven't recognized the severity of your symptoms, or providing Interstem is just not a focus of what they do. Now, if it's your primary care provider that's treating your overactive bladder, you know, their options are limited to conservative therapies such as medications. So since your PCP is not able to offer advanced therapies such as Interstem, you know, they may not be necessarily familiar with this therapy. Now, most urologists and gynecologists treat overactive bladder. However, most OBGYNs focus their practice primarily on delivering babies, performing routine annual exams, and other gynecological surgeries. Many urologists remain very busy treating men with bladder and prostate issues, as well as other general urological concerns such as bladder cancers and kidney stones. Now, because Interstem therapy is a major focus of what we do, our level of experience with Interstem attracts patients to our practice well beyond our local community. Our level of commitment to this therapy has gained us recognition as the nation's current leading provider of Interstem therapy.